Hello, my name is Mariah Peterson, and I will be presenting on the topic of human trafficking. So, just some generalized background information regarding human trafficking. It's defined as coercing a person to provide labor or services or to engage in commercial sexual acts, and that's according to the U.S. Department of Justice. As of 2023, there are over 27.6 million victims worldwide, with California, Texas, and Florida being the highest numbers within the United States of trafficked victims, and California is the number one state in which it occurs. So, some additional background information. Within the United States, as I stated earlier, California is the top state. However, 50,000 people are trafficked within the United States each year. A lot of places where it occurs are, you think about like football games, music events, very large gatherings of people. Within of those 50,000, 52% of those are children, and 94% of the victims are female. And it said that 50 to 90% of human trafficking victims have sought out medical care while being trafficked, and so that's a very important fact to keep in mind. So the typical presentation is they will appear disheveled, not able to answer questions, disoriented or confusion due to being forced to take drugs, in which then they become addicted to them, bruising with various stages of healing. They are usually accompanied by multiple men, sometimes a family member or an older woman. They often lack personal possessions. And again, the emergency room is the most common place of presentation while a victim is being trafficked. The chief complaints that they will come in with include abdominal pain, pelvic pain, STI symptoms, along with somatic symptoms, so headache, generalized pain. A lot of behavioral signs can be at play, so either flat affect, very animated, they can be very anxious, panic attacks. I've seen aggression and violence, so all those are things to think about. And then a lot of them are also chronically sleep deprived on purpose, and so their mentation a lot of times is just they can't even function and think straight. Stockholm syndrome is also an issue where the victim thinks that the trafficker is a friend and has their best interest, and so that creates a very difficult situation when that's occurring. So important screening factors that need to be kept in mind are separating the victim from the trafficker, which can be quite difficult because oftentimes they will refuse to leave. And you will keep a very close eye on the patient, but they do need to be separated, and oftentimes security will need to be involved. So then the next step is assessing the patient in a private room. That entails making sure the patient's in a gown, making sure you have a chaperone and that they're comfortable. Specific questions to ask are, do you feel safe at home? Can you leave your place of work if you wanted to? Do you know how to access help if needed? Assess them head to toe, assess for STIs, pelvic pain, assess urine, assess for any recent delivery of a baby child, and then assess for any tattoos or markings on the body. Oftentimes there will be something even behind the ear. Sometimes they're hidden, but they're there, so it's important to check. Assess for any signs of trauma, obviously, stages of bruising, and then always ensure that you're creating a safe environment for the victim. So sitting at the same level as the patient, making sure they understand that you're there to help, and just kind of approaching this situation in a delicate manner. So, evaluation and treatment. Once a victim has been identified, as stated before, as a provider, you're mandated to report this to the police. If the child's under, or if the victim is under 18, then it turns into a child abuse case. But then if they're older than that, then it's a human trafficking. Obviously, treat any withdrawal symptoms if they've been made to be addicted to a substance, in which most are. Ensuring that they're in a safe place is very important. Oftentimes, that's very difficult to obtain because the traffickers have a lot of connections, and a lot of times these victims don't have families, or they're runaways, or they've been in the foster system. So, ensuring that they have proper mental health resources. And then often medications such as SSRIs can be helpful to cope with any anxiety that I'm sure they will be experiencing from the treatment that they've been receiving. So, management of these patients is being aware of this issue and actually listing it as a differential diagnosis if it's suspected is important because, again, it's a mandatory reporting. So, you want to make sure that you're not missing it. And then always showing compassion toward the victim, as oftentimes they can be violent because they're not in their right mind. Most of the time they're confused, or, like I said before, drugs are being used. So understand again that if the patient is over 18, they still have the right to decline assistance, which is very sad, but often that happens because of the Stockholm syndrome, in which they view the trafficker as their friend, and they may not see you as trying to help, and they may not even recognize their situation because mentally they just can't. So developing trust is essential to maintaining management and treatment of these patients. And then always involving a multidisciplinary team. So that involves a psychologist, a social worker. Obviously, the police are going to be involved, and kind of going from there. So, risk to the patients. Oftentimes, they may have family or a child, and the trafficker uses this to control the victim by saying, threatening them with killing their family or their child if they don't do certain acts or do certain things. And so, even if they get out of the situation, they may never truly feel safe. And it may feel like a hopeless situation for them, even it's obviously horrible being in that situation, but also trying to get out of that and having those obstacles there. And then recovery will be difficult for many of them because, as stated before, there's often a lack of resources, including family, friends. So that's something to consider. So I just threw in a case study here because I work in the ER, and I actually had one come through the other day that we're pretty certain was. It was an 18-year-old girl. She presented to the emergency room for abdominal pain, but she had recently given birth 3 months ago. She was accompanied by 2 older men, roughly, I would say in their 40s, who would not let her out of their sight, and they would not let her talk. Going to a CT or any scans, they would not let leave. And so it was very suspicious. And it was also suspicious that the baby was not with the patient. She had a normal effect, but at times she wasn't answering for herself, and she was avoiding eye contact. So we ended up, we had to use security, and we ended up having to separate them, and we brought her back to a room, and unfortunately she denied she denied everything, and she said she was safe, and the provider didn't see any markings but was still highly suspicious. But this is a case of where probably it was happening. She even admitted that the two men essentially had her baby and they were taking care of the baby, so I'm assuming they were kind of holding that over her. But again, this is a case, she was over 18, or 18, and we could not obviously force her to do anything. So we did have to call the police, and they talked with her, and same thing. And so we actually had to discharge her back to them, and it's a sad situation. So the role of the advanced provider, so again, just making sure you're recognizing the signs of human trafficking. Prevention, I think, is key. So, in your routine visits, making sure that you're observing just for healthy behaviors within relationships, who's accompanying them, who's with them, ask about, work, family, home, those things I think are important, and it kind of gives you a picture, and then also gives you a picture if something changes. Promoting just, again, promoting the home environment, assessing this during regular provider visits, and then making sure that as a provider you're mandatory in reporting any abuse, especially if it's child abuse or trafficking, due to state laws. So the Christian worldview, as a Christian, we are called to care for those who are vulnerable. As providers with this worldview, we need to advocate for these patients and be on alert for them. As Proverbs 31 states, open your mouth for the mute, for the rights of those who are destitute. Open your mouth and judge righteously, and defend the rights of the poor and the needy. And furthermore, I think, oftentimes it's hard to kind of step up and be the one that's like, no, I think this is what's happening. And as Christian providers, we need to strive to do good and seek that justice out every time. Isaiah 1 says, learn to do good, seek justice, correct oppression, and bring justice to the fatherless, and plead the widow's cause. And I think also it can be scary to kind of step up and do that and stand up for what we know is right, because oftentimes that contradicts society and culture. And at this time in the world, that's a kind of a big thing right now. So I'm just going to end with Deuteronomy 31, in which that states, be strong and courageous, and do not fear or be in dread of them, for it is the Lord your God who goes with you. He will not leave you or forsake you. These are my references. Second page.